COVID actually took more of a hit on folks accessing mental health services than it did on folks accessing substance use services.
At this month's local Alcohol and Drug Planning Committee meeting, Julia Jackson from Jackson Care Connect gave a presentation on how people in our community have been utilizing mental health and substance abuse treatment over the last few years.
This is just a snapshot of our membership. In March, it was at 55,972. Right now, it's at 57,451. That was as of the 15th. This is a look at mental health in the red line and substance use in the green line percentages. So of our total 57,000 members, for example, in 2021, 19.7% of all of those members are accessing mental health services, and 7.4% are accessing substance use services in both specialty behavioral health and primary care settings. So what that means is, this could be like in a physical health care setting or like an actual treatment center. This is both settings. So you can see that year over year, typically, except for COVID, there's been an increase in folks accessing mental health services, but not so much in substance use services. 2019 was probably the biggest peak in that. And then, again, COVID actually took more of a hit on folks accessing mental health services than it did on folks accessing substance use services. But still, there was definitely a dip there. This is looking at how mental health services are accessed differently in specialty behavioral health setting versus primary care. So primary care setting is in this green line, and specialty behavioral health clinics is in the red. So this just means that there's far more folks accessing mental health services in settings that are designed to treat mental health than are in physical health or primary care. Same with substance use. Folks are accessing substance use services more than normal, more than typical in primary care or physical health settings, and a little bit less in specialty behavioral health settings. Okay, so this is just looking at this year so far. In 2021, it's been pretty static. We had a slightly higher start to the year in January. 20% of folks accessing mental health services, 7.6% of all of our members accessing substance use. It's gone down a little bit for both mental health and substance use utilization. So average length of stay in residential last year was 36 days. Average length of stay this year is trending at 29 days right now. We know more clean time, the better. So we hope to see a slightly longer average length of stay there. Also, this is deceiving. This looks deceiving. These numbers of 97 visits and 89 members in residential thus far is basically, again, that's only a fourth of the year. And for the whole year it was 307 visits. So it is on track to surpass that this year in residential stays based on the fact that we're only at a fourth of the year. This is interesting. It's member visit ratio per setting for detox. So if you look over to the left first, for ARC providing detox in their setting, it's an average of one member per one visit. But in the ER, it's an average of someone going there twice. So one person on average goes there multiple times. And in inpatient, one person on average goes there 5 times. So this just kind of shows that ARC looks like the most effective setting for providing probably providing a little bit stronger discharge and follow-up and transition support for folks to reduce that recidivism. Okay, last slide is emergency room utilization. This is rate per members because our membership changes every month. So we do it in rate form so that you can look at a trend over time. So the highest year of emergency room visits by folks who had folks who were suffering from a mental health diagnosis in red, that's the red line, and folks who were suffering from a substance use diagnosis in green. So the highest year of utilization in the ER was in 2017. It decreased drastically until 2019, continued decreasing in 2020, and we have seen an uptick with folks who have mental health diagnoses. But continue to see it kind of stay semi-stable, a little bit of a decrease with substance use.
This is for quarter one, January, February, March of 2021. The all care membership just under 16,000. First category there is the number of folks in outpatient treatment at 323. The next is the number of folks who made use of detox. This is all claims-based data, so this would be at least one encounter. And the detox may be local or it may be regional. So I just wanted to mention that. And that's 14 folks there. Number of folks in rehabilitation, otherwise known as inpatient residential treatments, would be 41. And then we go to the hospital visits. The number of folks who were admitted inpatient at the hospital where their primary diagnosis on the claim was substance use disorder related was 9. And as I said last time, if we were to say the secondary or tertiary diagnosis was SUD related, that number would jump exponentially, right? So that would be folks who come in for a broken arm or a fall or a motor vehicle accident, where the secondary or tertiary diagnosis would be, alcohol intoxication or other stimulant abuse, uncomplicated, etc. But for the ones with the primary SUD diagnosis, that's 9. And then for the ED visits, again, where the primary diagnosis is substance use disorder, that is 71. And that number would also grow if we sort of opened that up to secondary and tertiary diagnoses. And then of those folks who showed up at the ED, the percentage of those 71 folks who were already engaged with a substance use disorder provider would be 23%. And that's based on at least one substance use disorder claim. And then the percentage of ED patients engaged with assigned PCP in that quarter who showed up at the ED, that would be 13%. And this is quarter by quarter. So the blue was the last set of data that I presented quarter 4 of last year, and then the red or orange, if you will, is quarter 1 of this year. You can see in terms of number of folks engaged in outpatient treatment and number of folks in inpatient residential and ED visits all went up, while those of detox and the inpatient admits decreased a little bit for this quarter of 2021.